All right, welcome everyone to the Certified Nurse Aide Virtual Career Day for Eastern Iowa Community Colleges. I'm Heather Evans and I serve in Admissions and Community Outreach. I'm based out of our Clinton campus, but I serve our entire district with Clinton, Scott, and Muscatine. And from EICC, I have with me Dustin DeWert. Dustin, you want to share what you do with the college?
Sure. So I am the Iowa Vocational Rehab Career Coordinator. So I work closely with Voc Rehab, working with kids with disabilities on whether or not they want to go to college or just enter the workforce after they graduate. So I just kind of process with the students whether or not that's a decision they want to make. And if they want to enter the workforce, then we work on just basic job skills, getting them involved with job shadows, classroom presentations. If they do want to pursue college, I help with the FAFSA and kind of just get the process of hooking them up with the admissions rep at each of the schools. So I'm just, a resource with all high school kids, freshmen through seniors, and just kind of figuring out that next phase of their life and what they plan on doing. So.
Thank you. And Dustin will monitor the chat. I mean, we're an intimate group here, so certainly if you or your student have any questions, Lori, feel free to either put them in the chat or just kind of ask them as we go along, whatever's most comfortable for you all. But Dustin will keep an eye on that chat for us this morning. So we are super pleased to welcome Deb Ludvigsen, and she is with us from Eastern Iowa Community Colleges. She has been a nurse for over 20 years and started her career at age 16 when she took the CNA program. She became an RN through Clinton Community College and has worked as a nurse in med-surg, the emergency room, long-term care, and home care. She was a CNA instructor and has been with Eastern Iowa Community Colleges for 9 years and has been the CNA Program Manager since 2018. So we're super thrilled to have Deb with us today, and I'm going to turn it over to her.
Thank you, Heather. I'm going to start off by doing a PowerPoint slide presentation. So I'm going to be sharing my screen here and seeing how this works. You guys all see that? And can you hear me okay? Okay. So what is a CNA? A CNA is a certified nurse's aide. The nice thing about the CNA program is it is a short training program, 4 to 16 weeks. So the class is actually 80 hours and 50 of those hours are in the classroom. And then the last 30 would be done at a local nursing home, and that would be your clinical hours. So if you took a class that met for 5 hours and it met 4 days a week, you could actually complete the CNA class in 4 weeks. So it can be done pretty quickly. Most of our classes are done in about 6 or 7 weeks. The nice thing about being a CNA is that there is no college required. There is a constantly high demand for CNAs, and it's a good way to start acquiring nursing skills because having your CNA is a requirement for entering the nursing program. What do CNAs do? Well, once you get in the classroom, we will actually spend a lot of time in lab learning 30 different skills, and I have some of them listed here in this slide. We will teach you how to do all of those skills listed there. There are 10 qualities that a CNA should have. One of them I have listed as patience. You're going to be working with people who are ill and disabled, and it requires a lot of patience and understanding. People who are patient, they remain calm and they are able to cope with difficulties without complaining. You should be adaptable. For a CNA, each day is going to be different. Some days are smooth and some days can be a challenge. So you have to be able to adapt to new situations. You should have a strong work ethic, and by that I mean being dependable and responsible. Nurses, aides are counted on to do their tasks properly. You should be compassionate and empathy. That's not something we really can teach you in the classroom, but empathy is, or empathetic people are people who identify with the feelings of others. They care about other people's problems. You should have a high attention to detail. Whatever you are doing, whether it's weighing a patient or taking a temperature, you must do it properly. You should have a great sense of humor. My light just went off in this room. You should have a great sense of humor. Language and humor definitely, or laughter and humor definitely belong in your workplace. Both staff and patients can benefit from being lighthearted at times. You should have great communication skills. The nurses are depending on you to report significant changes that you see in these residents. You should have physical strength. And by that, I mean you are going to be on your feet all day long. You should be able to lift between 35 to 100 pounds. You should have good tech skills. So those skills that I listed on the other slide and told you that there was 30 things that you would learn, you should be able to do them. And you should have tolerance for many tasks. Where do CNAs end up working? 40% work in skilled nursing facilities. 11% end up working in settings with elderly clients. 25% work in hospitals. And then the other 24%, there's kind of a combination. Some of them work in the school systems. Some of them work in home care, hospice. Those are just some of the suggestions. How much do CNAs make? I get asked that question a lot, and usually when somebody asks me how much a CNA makes, I respond by saying you make a difference. That is definitely what you make. I would say, having worked as a CNA myself, it is definitely the most rewarding job that I ever had. Not the highest paying, but this average wage is actually from 2017. The latest documentation that I seen was from 2019, and that they are now reporting $14.25 an hour is the average for a CNA, or the average yearly salary is $29,640. Most facilities are reporting between $14 to $17 an hour for a CNA. So there's a few things that determine a CNA's wage. Southern states tend to pay a little bit less. CNAs with work experience are generally hired at a higher hourly rate. And with more responsibility and specialized training, CNAs can actually have an increase to $1 to $3 or more. Once you become a CNA, we have a class here at the urban campus, and after you've been a CNA for 6 months, it's called a Med Aid course. And we have a lot of CNAs that take this course because once they complete it and pass, they are able to pass medications at a long-term care facility. So a lot of our CNAs do take that class because they end up making $1 to $3 more an hour by becoming certified as a Med Aid. Job outlook is really good. An increase of more than 21% in this job field. You should have absolutely no trouble finding a job anywhere. If you're a person that likes to work days, you can probably walk on into a facility working a day position. If you like second or third shift, you would have no problem getting that and would get a good shift differential. We have facilities that are doing 10-hour days. We have facilities that are doing 12-hour days. Lots of sign-on bonuses right now at any long-term care facility. We have some places that have weekend packages. So you may work Saturday and Sunday a 12-hour shift, which is 24 hours, and get paid for 40 hours. Really some attractive work options right now. So these are the admission requirements. In order to take the CNA class, you will have a background check that is done on you. You must be able to read, write, and speak English at a 6th grade level or higher. You have to be able to lift between 35 to 100 pounds. If you are pregnant, we need a doctor's note saying that you have no lifting restrictions. 100% attendance is expected. It is a very short class and it is a very fast moving class. So 100% attendance is expected. There is a dress code. Once you get to clinical, you will be wearing navy scrub pants and a white scrub top. Also clean tennis shoes and a watch with a sweep second hand. Some of the clinical sites are requiring flu shots, and then a negative two-step TB test or a quantiferin gold blood test is also required for clinical. And that is what I have. Once you decide and you're interested in becoming a CNA, your next step would be to fill out that background check information and get signed up for the class. There's a little bit of waiting list on some of the classes. We have a hybrid CNA, which is very popular this summer, and it filled up really quickly. But most of the other classes that meet in person for the whole class, there is a lot of opportunities and you shouldn't have any trouble getting into a class. I talked quickly. What questions do you guys have about the CNA program?
I'll ask a quick question. I know this is one that I've shared or I've asked kind of over time because I get it from a lot of students. So if a student were to become certified here in Iowa to become a CNA, but then their family moved over the river and decided to live in Fulton or in another state, what would happen? Would the student still be able to be a CNA in that state, or would there be some things they have to do or start all over?
That is actually a great question, Heather, and I get asked that a lot as well. In fact, I get asked that so much that when the students come to state testing, I provide the paperwork for them to get certified in Illinois. Currently, there is no charge to get certified in Illinois, so I'm really pushing students to do that because normally it's a $75 fee, but because of COVID, they backed off on that. Really easy to transition and get your CNA in Illinois. It depends on the state. Wisconsin's a little more tougher. Wisconsin's CNA class is not 75 hours. I believe it's 120 or 150. So they actually require them to work as a CNA for 1,080 hours before they would accept them. So each state is different, but Illinois, very easy to become certified in Illinois as well. Yeah.
You may have covered this in the presentation. Will you remind me again, how long does the certification last once you've become certified?
I don't think I covered that actually, Heather. Your certification would last for 2 years if you did not work in a long-term care facility. So if you continued to work in a long-term care facility, that certification would be good forever. And it's actually your certification that does not expire. It's being active on the registry. So in order to stay active on the registry, we require a student to work at least 1 8-hour shift every 2 years in long-term care. And if you don't, and you fall off the registry, you wouldn't have to repeat the whole course over again. You would just have to come and repeat and pay for your state testing. Did that make sense? A lot of times students are confused by that. We do have quite a few people that fall off the registry. You know, they work as a CNA and then maybe they're a stay-at-home mom for a while, or they choose a different occupation and then they decide they want to go back into the CNA, and And so then we see them at state testing, trying to pass and get active on the registry again.
Well, I'll ask a question.
Sure.
So I work with, like I said, I work with a lot of high school students, and they have IEPs, so there might just be a slight disability or whatever the case may be. But I'm working with a girl individually now that I'm thinking about that she wants to go into long-term care facility, but we're just trying to figure out. I've talked to her a little bit about the CNA program. What would you recommend her taking the CNA program or just trying to get a job at a long-term care facility? And that would probably just be like doing basic work, but I think she wants to be a CNA. Do you see a lot of individuals that, I mean, they have to have a CNA degree, or can they just kind of work their way in, or how, I guess what's my best advice to tell this individual?
I think maybe to have her start off working in long-term care and maybe in the dietary or housekeeping department. A lot of times they will work in those, and then they'll really have a passion and they want to continue on and be a CNA. Other times they don't. So that would be my best suggestion, is to have her work in maybe one of the other departments and go from there.
Okay. Yeah, I think that she definitely would excel as a CNA. She's again one of those seniors that just really doesn't know what she wants to do, and a lot of things floating around in her head. But I think I'll pass that on, and I think we're still exploring the CNA program as well. But yeah, I think just getting her foot in the door might be the best step for her.
Yes.
And do you see a lot of CNAs that move on into nursing, or do they just are content with CNA and kind of just do that for a while?
That's a great question. I would say definitely more than half go on to become nurses. I would love to follow up with that and see where they end up.
Mm-hmm.
There are some that they just, CNA is what they want to do, and that is their career for the rest of their life. So
yeah, I work with a lot of kids that want to be CNA or want to be nurses, and they don't want to be CNAs, but they haven't really explored that option. And I think a lot of the kids that I work with would be awesome at, being the CNA component, just to, do the helping and being able to be that support for them without actually the whole nursing process. So I do a lot of plugging with the CNA program. So
yeah, it's a great program, and we definitely need good CNAs.
mm-hmm.
I would just comment, having spent a good amount of time in hospitals with family member, the CNA role is, such a valuable role for when you talk about empathy and compassion, and you can really make or break someone's experience and the family member or support system that they have there with them. Or if they have no support system with them, especially in times like right now when there's been such limited opportunity, and CNA position can really make such a big difference in that experience. So I think it's such a commendable, role, and just a really great career path for students. And whether that's to start and continuing on with nursing, or to start and stick with that, all the way through, it's just definitely such a valuable component to health sciences, for sure.
I agree. Yeah. I agree. And they are now, well, I think it's been since 2010 or 2012, but they require you to become a CNA in order to get into the nursing program. And I really think it's a great requirement. I do. And it also helps them to decide. A lot of times they're, then they decide that this isn't the career path they want to take, or they decide that they want this more than anything. So I think it's great that it's a requirement for the nursing program.
Yeah, I was just going to ask that question if it was a requirement, but I agree. I think that's good for them to kind of see like the whole realm of nursing, and CNA is a big component of it. So I think that's awesome that they have to take that in order to see kind of what these smaller things are, the very, very important things, like you guys were saying. I think it's good for them to see the whole perspective of it.
Lori or AJ, do you happen to have any questions at all for Deb or for us at all about any pieces?
Okay. AJ says he does not have any questions.
Okay.
He's just taking it all in.
Wonderful. Exactly why we wanted to share the information. And you'll be able to access it again after the fact if there's anything more you wanted to look back into or, you know, talk with any of us any further, or sit down and talk with Deb a little bit more, or anything like that.
Hang on, I think we have a question. What was that? Oh, are tennis shoes okay at work if you're a CNA?
Yes, as long as they're like non-skid tennis shoes, which most of them all are, that would be fine. Crocs are not good.
Probably not dudes either. We learned that
What about
dudes are really slippery.
what about those? What about like the Vans, like the slip-on? I think, yeah, as long as it has a rubber sole, something you're not going to slip, right?
Yep, correct.
Yeah. Thank you.
You're welcome.
Wonderful.
We have another question.
Great.
I should have logged him. I should have logged him on this Zoom. Say that again. More about dress code. AJ has dyed hair. He likes to dye his hair. Would that be an issue?
It would be for clinical. They require that it's natural colored hair. So no pink hair or blue hair or green hair. You know, if he's blonde and he's dyed it brunette, that's fine. But that he is correct. No natural colored hair. So.
Okay.
And for the ladies, we say no acrylic nails. So that's another part of the clinical too, is nails should be short filed.
Since we're on that's the
So
type
you really
of
want a
question.
professional?
I do a lot of talking with the students that I work with about tattoos and piercings. What is the policy in most nursing homes, I guess, or in the CNA program with tattoos and piercings?
That is a good question, Dustin. We have recently changed our policy because we used to have everything was covered, no tattoo showing at all. And now we are following the policies of the long-term care facilities. And they are okay with the tattoos as long as they're not offensive. The student can have a tattoo and not have it covered. The same way with the piercings, we have still stuck with our rule as no facial piercings, just because we don't want them falling out or getting pulled. So we do not require we do not allow any of facial piercings. They can have their ears pierced with the post style earrings, but other than that, no facial piercings. Tattoos are okay. And that's just for the clinical part. In classroom, you know, piercings are fine, but it's just for when they go into the nursing homes.
And you say that's mostly just for like a safety precaution with like nothing falls out and.
Yes. Yep. Yeah. Same way with no necklaces or bracelets, you know, we don't want them to get their necklace pulled or hurt or anything. So just a wedding ring, but that's about it.
Makes sense.
Yep.
Yeah, we have some pretty heated debates about tattoos and piercings and what's appropriate, what's not appropriate, and different businesses that allow them and certain businesses that don't. So it gets to be kind of fun.
Yes, I agree.
I have a question. I could Google it, but I'll just ask you. So if a student does decide that they would want to go from CNA to nursing, what would be the first nursing level and how long would that take to attain approximately?
Oh, that is a good question. I really do not know the answer to that. The nursing is kind of separate, Lori, than the CNA. The next step, I would assume, would be nursing fundamentals, would be my guess, or some prerequisites. You know, the CNA would be one of those prerequisites, but probably depending on what classes the student has taken. I know when I took it years and years ago, we had to do A&P 1 and A&P 2. So
That's the same now as well. And the student could go LPN or they could go RN. So the LPN's a little bit shorter time frame. The RN is the registered nurse, so that's just a little bit longer. That's your full registered nurse program. So, but those prereqs that you're mentioning, Deb, those are still intact. So that would be kind of the next step, and CNA would be a piece of that. All right, any more questions at all? All right, well, we want to thank you for joining us today. And Deb, thank you so much for taking the time and sharing all of your knowledge and for everything you do with us. And this information will be shared by recording, so we're happy to share it out with anyone else that would like the information. So we can certainly share that with you once we have it ready to send out. So thank you so much for joining us and have a wonderful rest of your day.
Thanks so much.
yeah, thank you.